If you have a meniscus tear, one of the first questions you may ask is, do I need a surgery? And the honest answer is, not always. Some meniscus injuries can improve with physiotherapy, activity modifications, and time. But some tears, especially unstable tears, locked knees, large traumatic tears, or repairable tears in the right zone, may need surgery to protect the knee and to restore the function. Today I'll explain what meniscus surgery really means, the difference between the meniscus repair and partial meniscectomy, and what recovery usually looks like. I'm Dr. Tomislav, orthopedic surgeon, specializing in sport injuries and knee surgery. The meniscus is a C-shaped cartilage structure inside your knee. You have two in each knee, the medial meniscus on the inside and the lateral meniscus on the outside of the knee. Its job is not small. It absorbs shock, distributes body weight, improves stability, and helps protect the joint cartilage. So when we talk about the meniscus surgery, the goal is not simply to remove the pain. The real goal is to preserve as much as healthy meniscus as possible. Because the more meniscus tissue we can save, the better we protect the knee in the long term. A very important point: an MRI can show a meniscus tear, but that doesn't mean automatically you need a surgery. Some degenerative tears, especially in middle-aged or older patients, can appear gradually over time. This may be associated with early arthritis, cartilage wear, or general knee overload. In these cases, the first treatment often is non-surgical. Physiotherapy, strengthening the quad and the hip muscles, reducing swelling, avoiding painful twisting movements, and improving the knee mechanics. So the decision is not based on MRI alone. It is based on the patient's symptoms, examination, age, activity level, tear pattern, and the condition of the cartilage. Then we decide what is the best for that specific tear. There are usually two main surgical options. Repair is more protective in the long term because we are saving the meniscus. But repair needs patience because the tissue must heal. Recovery is usually slower, and the patient may need limited weight bearing, restricted knee bending, and a structural physiotherapy. Number two is a partial meniscectomy. This means trimming only the damaged, unstable part of the meniscus while preserving as much as healthy tissue as possible. Recovery after trimming is often faster than repair, but the trade-off is that some meniscus tissue is removed. That is why we try to remove as little as possible. In modern knee surgery, the principle is simple: save the meniscus when possible and trim only when necessary. So which one is better? It depends on the tear. A repair is better when the tear can heal because it keeps the natural shock absorber inside the knee. But not every tear can be repaired. The inner part of meniscus has a poor blood supply, so some tears have limited healing potential. In those cases, stitching may fail, and trimming the unstable part may be more realistic. The key is a proper patient selection. For a young athlete with a fresh traumatic tear, we usually think strongly about repair. For a patient with a degenerative tear and an early arthritis, surgery may not be the first step, and physiotherapy may be more appropriate. For a locked knee from a displaced bucket handle tear, surgery may be urgent because the knee cannot move normally. This is why meniscus treatment must be personalized. Recovery depends on the procedure. After a partial meniscectomy, many patients walk quite early and return to normal daily activities faster, depending on pain, swelling, muscle control, and the surgeon guidance. After a meniscus repair, recovery is usually longer. The knee needs time to protect the repair. Return to sport may take several months, especially for pivoting sports like football, basketball, tennis, or padel. But recovery is not only about the time, it's about the milestones. Can the knee fully straighten? If the swelling is controlled, is the quadriceps strong? Can the patient squat, land, cut, and pivot safely? Returning too early can increase the risk of re-injury. So remember, meniscus surgery is not one operation for every patient. The best treatment depends on the type of tear, the blood supply, stability of the fragment, your age, your sport, your symptoms, and the overall condition of the knee. The most important message is this: a meniscus is not a useless tissue, it's a protector of your knee. So the goal should always be preserve when possible, repair it when appropriate, and only remove the damaged part when truly necessary. If you have a knee pain, locking, swelling, or pain with twisting, get a proper assessment before deciding on surgery.